Hello, I'm Christopher Hirose. I am an orthopedic surgeon at the Coughlin Clinic here in Boise, Idaho at Saint Alphonsus Hospital. I want to talk to you about ankle joint arthritis and one treatment for that, which is ankle joint replacement, like you see right here. The ankle joint is a joint made out of three bones. On the top, we have your tibia, and lateral to that is a smaller bone called the fibula. Those two bones cup the talus bone underneath, and that is what makes up your ankle joint. Now, all of our joints are very unique. It's a very smooth surface that's constantly moving. The bone, the cap of it is capped with cartilage, which is a very smooth surface, and this is encased in a sac, the joint capsule, and within that sac you have a fluid called synovial fluid. The synovial fluid has a consistency of egg white. It's a very thick, viscous material. Synovia comes from the Latin root egg, after all. Now, when you have all of these together, it's a smooth surface, and it turns out that cartilage on cartilage is smoother than ice on ice. How much smoother? It's about 100 times smoother than ice on ice. And so when all these come together, what we're left with is this very smooth, painless joint motion, like most of us have. Ankle arthritis, what is it? Well, this is when the joint degenerates, and it begins with cartilage damage. Typically, you may have injured your ankle, sprained it, or had a fracture. And when that occurs, the cartilage, which is normally smooth like a cue ball, will begin to degenerate and fray like you see in this image here. And it typically gets worse with time to the point where you no longer have the smooth surface. Some people will have a big pit that develops and lose some bone where they have exposed bone in this big pit. It will typically progress until raw bone edges touch each other. This becomes painful because it's like sandpaper rubbing on sandpaper, and that hurts. Now, here's an example of someone who has bad ankle arthritis. That space is gone, but overall their alignment is really quite good. And on the flip side, you'll have someone with this same problem, but their alignment is terrible. So this joint is now angled about 60 degrees over. And if you look at this person from the side, his heel's coming inward and his ankle joint's nearly touching the ground. Why do something about this? Well, we talk about symptoms. A lot of people will have pain when they have bad ankle arthritis. Some people cannot do what they want to do and enjoy life. And there are others who really cannot walk at all because of their deformity and their pain is so severe. Those are all reasons to consider doing something about it. In our clinic, we always try to start off conservatively. And these options include modifying one's shoes. This is a shoe with a rocker bottom deformity. It will help someone with a stiff arthritic ankle roll over a little bit easier to self-propel. Sometimes we'll prescribe a brace such as this. This is a custom Arizona AFO brace that can help. Sometimes we'll prescribe medication like Aleve, which is a common anti-inflammatory medication. And lastly, we could consider a steroid injection into a joint, which will decrease the inflammation. Now, if someone fails conservative treatment and we feel that you would be a candidate for surgical intervention, we can consider two main options. The option we're going to talk about today is becoming more popular, and that is replacing one's ankle joint with an artificial total ankle arthroplasty. And the reason this is important is because people really want motion, and a total ankle replacement will allow for increased motion that you see right here. This is the Scandinavian total ankle, in which case the talus is capped with a metal cap, the tibia is capped with a metal plate, and in between there's a floating bearing, just like a total knee or a total hip. This was developed by Dr. Kofoid in Germany, and our clinic has established a track record for the Scandinavian ankle. So here's an example of one of my patients who wanted to proceed with the replacement, and you could see the same thing on X-ray image from the front and from the side. This is what a well-positioned total ankle should look like. Now, how would you do if you receive a total ankle? Well, in our clinic, this particular ankle prosthesis has done quite well. In fact, 94.4% of our patients at about 12.6 years have done good to excellent with this particular implant. Here's an example of someone who wanted to have this done, who wasn't able to cross-country ski beforehand, and after his total ankle replacement, he's smiling, pain-free, and back to cross-country skiing. Now, here's what to expect during this process. You'll meet our team, our anesthesia team, our nurses who will take care of you before surgery. You would undergo what we call regional anesthesia, a block to make your leg numb. This is done before surgery. And then during surgery, we use sterile technique and stay sterile with special protective hoods that are ventilated. Surgery takes as long as is necessary to make sure the procedure is done as perfectly as possible. And then afterwards, you're in the hospital until you are doing good. This is someone who has a splint at first, and then you would undergo physical therapy starting immediately, keeping your weight off of this, either with crutches or with a scooter. And then before you leave the hospital, we check your incision to make sure everything looks good, and you get a cast, at which point you will remain non-weight bearing and then come back to clinic. From week 6 to 12, we put our patients in a cam walker boot and then start physical therapy. Here's someone who's going through physical therapy at our physical therapy department. And you could see this person doesn't hurt anymore. Her pain level has plummeted significantly, and she's walking very comfortably. The physical therapy team will have our patients go up and down grades to increase their motion to make sure they're safe going up and down stairs as well. Now, the benefits of total ankle joint replacement include pain relief. Most people, their pain plummets. And also, it preserves joint motion. So here's an example of the STAR total ankle, and you could see that it moves in all planes, in dorsiflexion, plantar flexion, and then it also rotates back and forth. Thank you.